Matthew Holt, JCB Quick Bite. This is Brad Kittredge. He is the CEO of Brightside Health. Look, we're actually in your fancy booth at the Behavioral Health Tech Conference. Brad, Brightside's been around a little while now, essentially a large online medical group dealing with mental health care. Tell us, there are a lot of companies in the same space. What's different and better about Brightside than the rest?
Good to talk to you, Matthew. Brightside's been around for 7 years now. We started in 2017 with a singular mission of delivering measurably better outcomes at scale. In this industry, a lot of us and a lot of people talk about the need to improve access to mental health care. Of course, that's a clear need, but we believe it's a symptom of a deeper underlying systemic quality problem that particularly affects specific populations in mental health. So think of those with elevated severity and acuity, underserved populations like teens or those in Medicaid or Medicare. And so our specific focus is on solving the longstanding intractable challenges associated with mental health care delivery, particularly showing up at the emergency room and inpatient psychiatry, the costly, hard events that payers and providers consistently struggle with.
So, good aim, hard to do. How are you pulling it off? So by that I mean, who are the customers who are paying you? And then what's the delivery system that you've put together?
We built our own technical stack and our own network together from the bottom up. So we offer care in all 50 states and DC. That includes precision psychiatry, evidence-adherent therapy, suicide reduction programs, and now IOP for substance use and mental health coming soon. And we work with payers. We're in network with about 135 million covered lives across commercial, Medicare, Medicaid, and exchange lives. And we also work with health systems who are struggling with the volume of patients at the emergency department and a readmission rate somewhere around 14 or 15% every 30 days. We also, though, know that consumers are driving a lot of their care choices directly, so we've got a lot of direct consumer outreach and engagement in addition to those relationships to make sure we can reach people where they are, bring them into care, and get those great results.
All right. What is I assume, if you're doing everything, I assume that you see a lot of depression, you see a lot of anxiety. We were talking off camera about measurement, and we have some old measures that get quoted a lot in that space. But I've also heard stories that most people undergoing some kind of mental health treatment in this country don't even have a proper diagnosis, let alone measuring what happened next. So, what is your philosophy and actual practice regarding diagnosis, measurement, and progressive improvement?
Yeah. Well, I think one of the stats you're referring to is probably an adage about the portion of mental health care prescribing that has traditionally happened in the primary care setting, and that a large portion of patients who are receiving a mental health medication don't even have an associated diagnosis. And that creates a lot of noise and confusion in the data, a lot of expectation that this class of medications is being used suboptimally at best. And generally we would agree with that. It's one of the arguments for specialty care and for better access to highly focused subspecialty and specialty care for mental health conditions. On Brightside, every patient gets a diagnosis. Of course, I think that should obviously be standard across any mental health practitioner. But we also go beyond that to really address the guess and check prescribing that's been so prevalent in traditional care, using our own set of algorithms that we developed to identify specific subtypes and unique presentations of patients, map those to the research, and enable our providers to make data-driven prescribing decisions to get it right on the first medication about 70% of the time, which is about double the traditional convention there. And so then, it certainly goes into outcome measurement from there, and we all know that PHQ-9 and GAD-7 are not perfect measures, but they're the best gold standards that we have available to us today, and that create an important set of longitudinal outcome opportunities and a feedback loop into care. And so, it provides a common way for all of us to be able to measure and compare outcomes.
And then the flip side of that is sort of quality of provider network and management/training of them. What do you do that?
Our entire network is built and managed by Brightside and by our clinical team. So we source, interview, select, train, and supervise all of our clinicians in-house. I think one of the mistakes and challenges of this industry historically is treating clinicians and clinical slots as interchangeable, as if any appointment will do. So it's important to select the right clinicians, ensure they're trained and working under the right system with the right support, supervision, quality controls, and tools to be able to make timely and effective decisions. And so we curate and closely manage the performance of our network and give them the tools to be successful.
All right, and give me a flavor. You mentioned, sorry, I've now forgotten the number. 130 million Americans on, lives. Give me a flavor of number of visits a month, a week. How do you quantify the activity going on in your system?
Well, of course, we're a private company. We got to be a little cautious about the things we share.
You wait till the next question. I think that was bad.
All right, yeah, I love the probing. It's fair. So we've got about 135 million covered lives under contract with payers, working closely with great partners like United Healthcare, Aetna, Cigna, and Centene. That is across commercial, Medicare, Medicaid, and exchange. So supporting people independent of their health insurance. We want to give them timely access to the highest quality care. I will say that Brightside has delivered well over 1 million encounters to support those with the highest severity needs.
So a quick swap of locations here. Tell me, Brad, so a couple of questions to follow up just on Brightside. So how much you raised? And then there is the whole issue that, after you raise a bit of money, eventually those folks who give you the money would like it back. A lot of companies in the space have raised a lot of money. How many do you think the market can sustain? And then give me a sense where you are in the process. I know there's a couple of mental health companies, the likes of Hinge and Amada talk about their S1s, but we haven't seen the sort of the mental health one start getting out yet. So give me a sense about where you think we are in that process, and tell me how much gain you raised.
Everybody's favorite topic, hence you had to track me down to keep talking about it, and happy to spend time thinking here. We've raised 150 million in capital, and building these kinds of businesses is not easy. It takes a lot of people, a lot of time and effort, and of course, everybody who invests wants to see a return there. As I think about it, I roughly break this market down into 3 segments, and that would be those mental health providers that are primarily selling to employers, those who are sort of platform and back office providers supporting billing for independent practitioners, and those who are focused on more clinically robust care models and focusing on partnering with payers and health systems to be able to solve really clinically challenging, important problems in this space. I think there can and will be successful companies from each of those verticals, and probably 1 to 3 from each vertical are going to be able to have an opportunity to grow to scale and to have some really great returns and outcomes. Our focus is on winning that third segment. We're very squarely focused on being the highest value behavioral health provider and partner to payers and health systems, and to solve some really intractable, high risk, high cost problems in behavioral healthcare. We think that's where the dollars are. That's where the dollars have been in the system, and where the opportunity is and the value to be created. And so we hope and believe that that's going to make us a big company and align our clinical and financial outcomes and deliver a nice return for our investors while really changing the market for the better.
And give me a quick timescale on roughly where that is. When you Amada's like 14 years in. I suspect that's a longer time than most investors would like.
It is. I mean, most venture capitalists think on a 10-year time horizon. Brightside's 7 years in, and they're one of the things that's true about this market is there's always more work to do. But I think we are on the cusp as an industry in the next couple of years where a lot of these investments made and the building that's been happening is going to start to reach a scale and a maturity point that we will start to see exits probably in the next 12 to 18 months.
All right, fantastic. Brad Kittredge, CEO of Brightside Health. Brad, thanks for your time.
Thanks, Matthew.